I'm Dr. Deborah Wilson, and this is Dr. Tom Waliser, and we're here to talk to you about laparoscopic hysterectomy, about the removal of large uteri through small incisions, and the media coverage of morcellation of the uterus, mostly through the Wall Street Journal. We've had a number of questions from our patients about whether morcellation of a uterus causes cancer, whether it spreads cancer, and we would like to talk to you about our experience with morcellation of large uteri.
Well, I've been doing laparoscopic hysterectomies since 2001, and so I've done thousands of morcellation procedures, and in that time I've seen very few cases of cancer. And I think the misconception out there is, especially with the FDA, they reviewed 9 really small studies and they came to the conclusion that 1 in 350 morcellation cases will be cancer. Since then, there have been more studies out there that show that the risk is actually about 1 in 10,000, specifically 1 in 8,333 was the risk.
Yeah, that's my experience. I've done about, I've probably morcellated because laparoscopic hysterectomy does not always involve morcellation.
Correct.
Oftentimes, especially when we're taking out the whole uterus, we can slip the uterus out intact through the vagina. So we only morcellate or cut up. Let's be clear about what morcellation is, and that is using a power instrument to cut up the uterus into strips so that we don't have to make a large incision, which is hard to recover from, long recovery, lots of pain postoperatively. So we're trying to avoid that by taking the uterus out through small incisions, but we need a power morcellator to do that. And I've done about 7,000 laparoscopic hysterectomies, and I probably morcellated 2,000 uteri, and I've never seen a case of cancer. Now, there are certain indicators that make me cautious about operating myself. If a woman is postmenopausal and the uterus is growing quickly, then I do suspect that maybe there could be a cancer, and I'll refer her to a GYN oncologist.
Right.
But not all laparoscopic hysterectomies involve power morcellization. And when we do morcellate, Dr. Waliser and I use a bag. So we contain the specimen in a bag that we put in the abdomen. There is a video of this on our website, and that does prevent any spillage just in case there's some cancer.
Yeah. And I really like using the bag because it actually has made morcellation easier for me.
Yeah.
I like how when we use the bag and we inflate it with carbon dioxide, it actually pushes the bowel and everything away, so you have a nice clear area. So it actually makes it safer, in my opinion, to morcellate.
I think so too. And also, I've had a few cases a long time ago of regrowth of pieces of fibroid that were left from a morcellated uterus. I've seen it in one of my patients and another patient who someone else morcellated a uterus on. So that prevents that. It's called leiomyomatosis, and that prevents that issue too. In fact, I just saw a patient today who had leiomyomatosis, and we had to go back in. So that prevents that issue. So I think that it's my feeling and Dr. Waliser's feeling that in the end, morcellizing will not go away, but as long as we do it in a bag, it's nice and safe. At this point, there's kind of a frenzy out there. You're seeing it. You're getting patients asking you about it all the time, right?
Yeah.
Yeah. But I think the level of concern is overblown. I think that there is a solution to the problem, and we don't want to go back to the dark ages when we're opening patients, making a huge incision for a large fibroid uterus when we could get it out through small incisions.
Yeah.
I mean, you remember those days. That
a lot of hospitals have banned the morcellator, and what they're saying, it's okay to extend the incision and then use a knife to cut up the uterus and take it out, but they're not requiring a morcellator bag. So they're still cutting up the uterus, and fragments are falling throughout the pelvis.
Yeah.
So
the whole thing doesn't make sense, but
no.
But we're happy that we're able to offer our patients who have a large fibroid uterus a safe and a minimally invasive laparoscopic hysterectomy with minimal recovery time, even if the uterus is quite large.
And also, with patients who want to preserve their fertility, we can remove fibroids. And we also will use the Morcellator for that. But also, again, we will place those fibroids in a bag before we remove them.
That's your expertise. So thank you for watching. If you do have a fibroid uterus and you're considering a hysterectomy, we'd certainly be glad to talk to you about the options.